Hello, my name is Jay Gonzalez,
I'm Tori.
and we're doing the lower quarter screen assessment. We're going to start off with the dermatomes, myotomes, and reflex. So I'm going to have my patient lay down. We're going to start with the dermatomes. We're going to start off with L1. How are we supposed to perform the lower quarter screen is have the patients close their eyes, and then we're going to do the assessment on them. We're going to have them see if they can feel this. Can you feel that?
Mm-hmm.
And then we're going to try and make sure that they're telling the truth by kind of like faking it out. Can you feel that?
No.
Perfect. So that's the type of pattern that we kind of want to do during this lower quarter screen assessment. So let's just get started. So we're going to start with L1. L1's going to be right here. Do you feel that?
Mm-hmm.
Do you feel that?
No.
Perfect. We're going to go to L2. Do you feel that?
Mm-hmm.
Do you feel that?
No.
Do you feel that?
Yeah.
Perfect. L2 is good. L3 is right here. Do you feel that?
Mm-hmm.
Do you feel that?
Yep.
Perfect. And then L4 is going to be right here. Do you feel that?
Yep.
Do you feel that?
No.
Perfect. And then we're going to do L5. Do you feel that?
Mm-hmm.
Do you feel that?
Yep.
Perfect. We're going to do S1 now. It's going to be the lateral leg and to the toes. Do you feel that?
Mm-hmm.
Do you feel that?
No.
Do you feel that?
Mm-hmm.
Perfect. That is S1. Then S2, I'm going to have my patient go prone. And this is going to be the posterior leg and the plantar surface of the foot. Do you feel that?
Mm-hmm.
Do you feel that?
Yep.
Perfect. That is the dermatome lower quarter screen assessment. Now we're going to do the myotomes of the lower quarter screen. So what we're going to start off with is L1 and L2, which is hip flexion. So I'm going to stabilize right here and have her raise her knee up. 3, 2, 1, don't let me break you. Great. Now we're going to do L3 is knee extension. So 3, 2, 1, go. 3. Perfect. And then L4 is dorsiflexion. So I'm going to have my patient start with the plantar flexion, dorsiflex. Don't let me break you. Perfect. And then L5 is great toe extension. So perfect. 3, 2, 1, go. Don't let me break you. Perfect. And now we're going to go into S1, which is eversion. So start off in an inversion moment and go evert. 3, 2, 1. Don't let me break you. Perfect. And then S2 is kicking our knee flexion. So I'm going to have my patient start off like this, and then I'm going to have her flex her knee. 3, 2, 1, go. Don't let me break you. Perfect. And those are the myotomes of the lower quarter screen assessment. And now we're going to go into reflexes. No, L1 doesn't have a reflex, so L2 and L3 have a patellar reflex, so we're going to just test that out right now. Make sure she has it. Perfect, that was a good one. And then now what we have here is the Achilles and Achilles reflex, which is L5 to S1. Make sure I'm in frame.
Mm-hmm.
So what we're going to do is just tap the posterior portion. You saw her her foot twitch a little bit. That's a good sign. All right, we're going to do the S2 reflex. So we're going to have the patient be in a prone position right here. And all we're going to do here is initiate the tibial nerve by tapping on the popliteal fossa. So as you can see here, if we tap it in the right area, it's very subtle, but you could see the ankle or the foot reflex giving us the sign that she does have a reflex. There we go. All right, that is a positive sign for S2. Thank you very much.
Okay, so now we're going to be doing an upper quarter screen. So we're going to go through all the different myotomes and dermatomes of the upper quarter. So first I'm going to start with the dermatomes. So C4 start along the shoulder, around here. C5 is the bicep. I'll have your hands laid out like this. C6 is going to be all the way up into the thumb. C7 is the palmar surface in the middle finger. C8 is the medial portion down to the pinky on the ulnar nerve. And T1 is over here. So now we're going to do a upper quarter dermatome screen. So I'm going to have the patient close their eyes and tell me if they feel the same on both sides when I touch them with the little thing. You feel this?
Yes.
You feel this?
Yes.
Feel this one?
Yes.
Feel this one?
No.
Feel it there?
Yes.
Feel it right here?
Yes.
Feel it right here?
Yes.
Feel it right here?
Yes.
Feel this one?
Yes.
Feel it on this side?
Yes.
Feel it on here?
No.
Feel this one?
Yes.
Feel it here?
Yes.
You feel it here?
Yes.
So that is the upper quarter screen for the dermatomes. So next I'm going to test the myotomes for the upper quarter screen. So we're first going to start with C1 and C2. That's going to be neck flexion. So I'm going to have you see if you can do that motion. Perfect. And now I'm going to have you resist my motion and resist. Sweet. And then same backwards. And go back, I guess, again. Sweet. And then next is C3, which is lateral flexion. So you're going to bend to one side. And then Dylan push you out. Awesome. And then go to the other side. And then push you out. Perfect. And C4 is going to be a shoulder shrug. So I'm going to have you shrug your shoulders. Dylan push you down. Awesome. And next C5 is going to be shoulder abduction. So do that. And Dylan push you down. Perfect. Next we're going to do C6, which is going to be elbow flexion and wrist extension. So Dylan pull you out. Awesome. And then Dylan pull your wrist out. Perfect. C7 is going to be the elbow extension and wrist flexion. So keep the same motion and push against me. Perfect. And then same with your wrist, push against me. Awesome. C8 is going to be opposition. So I'm going to have him make the OK sign. Dylan pull his fingers out. Perfect. And T1 is going to be finger abduction, adduction. So make that motion and squeeze my fingers. Awesome. And then spread your fingers. Don't let me squeeze them in. And that's going to test for T1. When you're performing a myotome assessment, it's important to understand the grading scale. This scale ranges from 0 to 5 out of 5, 5 being normal, 4 is good, 3 is fair, 2 is poor, 1 is trace, and 0 is none. So this is a good way to see how much a range of motion a patient has, whether they have full active movement, and whether it's against full resistance against gravity, moderate resistance against gravity, full range of motion against gravity, or if gravity is limited, or if there is no movement at all. So this is something we want to keep in mind. So next we're going to test the reflexes of an upper quarter screen. So there's 3 we want to look at. The first one is going to be the biceps reflex. So I'm going to come here and make sure the patient is relaxed and find kind of the biceps nerve right here, biceps tendon. And we're going to kind of hit it right here. And then we're looking for some slight contraction in the biceps region right here. So it's very subtle, but I see something. And the next is the brachioradialis, is we're going to test that reflex. So again, the patient's going to be relaxed here. And I'm going to quickly tap right here. And there should be some movement at the wrist. Sweet. So we see some movement there. And next is going to be the triceps reflex. So I have the patient relax, kind of have them at a 90-degree angle, kind of place my thumb where the tendons insert, and then lightly smack here. And then you can see the reflex going like that. So these are 3 of the reflexes we want to test in an upper quarter screen. So another portion of an upper quarter screen, or really just screen in general, if anyone has a head injury or has any signs of any cranial nerve damage, is you want to test all the cranial nerves. So I'm going to explain the first 6, and then he'll explain the next 6. So the first one is going to be the olfactory nerve, and so this is your testing by smell. So these are mints. Can you smell these?
Yes.
Sweet. That's good. The next will be the optic nerve, and so this is something where you want to have them read something close and something far away. So can you read my shirt?
Yes.
And then what does that sign over there say?
Danger.
Perfect. The next one is the ocular motor nerve. So this is where we're going to test his pupil reaction time. So using a pen light or phone, you can test pupils. So look straight ahead. Okay. Look straight ahead. And perfect. So his pupils are equal and reactive on both sides. Next one is going to be the trochlear nerve, and so this is where I'm going to have him follow my finger up and down. At the same time, we can test the abducens nerve, and that's going to be the cranial nerve number 6. So together, I'm going to have you follow my finger up and down. Follow your eyes down, laterally, and diagonal. So with this test, you're able to test 2 of the cranial nerves at one time. Makes it kind of fast and simple. And last one is going to be the trigeminal. And so this is going to be chewing, facial sensations. So I'm going to have you chew, and I'm going to palpate the TMJ area. Perfect. And then feel the same on both sides?
Mm-hmm.
Perfect. So he's good on that one.
Now we're going to do the second half of the cranial nerve, starting off with cranial nerve number 7, which is facial. I'm going to have her smile, frown, puff her cheeks. That is a good sign that the facial, oh my gosh, my head is by the frame again. So the facial nerves are working. Next is cranial nerve number 8, which is vestibular cochlear. That's going to be hearing and balance. So what we're going to do is test her hearing. Do you hear that?
Mm-hmm.
Do you hear that? Mm-hmm. Perfect. That means her hearing portion of the vestibular cochlear is working. Now we're going to try her balance. So we're going to have her go into tandem, hands on hip, close her eyes, see if she has her balance. She has her balance. kind of. Anyways, so next we're gonna do is glossopharyngeal, which is swallowing. So now we're gonna check if she's swallowing by putting her hand against her trachea. She is swallowing, and then say ah.
Ah.
Perfect. That means her glossopharyngeal cranial nerve is working. Now we're going to try her vagus nerve, which is gag reflex. I'm not going to make her gag with the tongue depressor, but that's how we would do it. Put a tongue depressor on her tongue, see if she has a gag reflex, and then that would determine whether or not her vagus nerve is working. Next, we're going to try her spinal accessory. Her spinal accessory is shrugging. Can you shrug? Perfect. That means her spinal accessory is working. Next we have is the hypoglossal, which is pretty much tongue movement. So what you want to do is just stick out your tongue. Perfect. And that means that her 12 cranial nerves are working. Thank you very much.